Hi, good day. This is my presentation on gonococcal gonorrhea by me, Moses Darfas, MD. So, gonorrhea, also known as the clap, is a sexually transmitted infection caused by the bacteria Neisseria gonorrhea. This is how the bacteria looks on gram staining. It is a gram negative rod, and you can see it there on the left side of the screen, and this is how it looks magnified. Neisseria gonorrhea is the second most common bacterial cause of sexually transmitted infection in North America, followed by chlamydia trachomatis. Globally, gonorrheal infections are now an urgent problem because N. gonorrhea is capable of rapidly developing resistance to multiple antibiotic classes. Gonorrhea are normally co-transmitted with chlamydia. However, for the purpose of this discussion, I am going to uh, talk about gonorrhea by itself. So gonorrhea is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for gonorrhea to be transmitted or acquired. Gonorrhea can also be spread perinatally from mother to baby during childbirth. So basically, seminal fluid or vaginal fluid can be transferred from one infected partner to the next. It can be transferred from the penis to the oropharynx through the rectum, as depicted in the image below. This is an image showing how the infection can be spread perinatally from the mother to an unborn fetus. Primarily, gonorrhea would be spread to an unborn fetus during the process of childbirth, where the rupture of membranes can get into the fetus's eyes or mouth. This is an example of the different routes of which a gonorrhea infection can be spread. So gonorrhea has specific signs and symptoms, but the signs and symptoms are specific to the gender in which it affects. The most common signs of gonorrhea infection symptoms in women are discharge from the vagina. Well, this discharge can be watery, creamy, or slightly green. It can also cause a pain or burning sensation while urinating, the need to urinate more frequently, heavier periods, or spotting or sore throat. It can also cause pain upon engaging in sexual intercourse and a sharp pain in the lower abdomen as well as fevers. Specific signs for men are greater frequency or urgency of urination. As you can see, this specific symptoms is can be seen in both men and women, also known as urinary frequency or urgency, a pus-like discharge or drip from the penis. Now this color can be white, yellow, beige, or greenish, swelling or redness at the opening of the penis, swelling or pain in the testicles, and a persistent sore throat. Remember previously I was saying that gonorrhea can be spread from the oropharynx, the mouth, to other sexual organs. If you are presented with a persistent sore throat, there may be possibility that you have oral gonorrhea, which is a different type of infection that can be present. Diagnosing gonorrhea can be simple. However, a sample of cells will need to be analyzed. These samples can be collected by a urine test or a swab of the affected area. A urine test will help identify if bacteria is present in the urethra, and a swab of the area may be the patient's throat, urethra, vagina, or rectum can be collected and the test can be run for amplification purposes. So the chemical test that is used is the nucleic acid amplification testing, also known as NAT. It is the recommended method of testing for gonorrhea. NAT is a molecular test that detects the genetic material DNA of Neisseria gonorrhea. Clinical symptoms of penile/vaginal discharge can assist in the diagnosis, but laboratory testing is more specific and sensitive. Now, high-risk groups that can be affected by Neisseria gonorrhea are most commonly young people ages 15 to 24. The CDC estimates that about 5 out of 8 cases are from people in this age group. One reason why this age group may be have higher susceptibility is because individuals in this age group tend to have more unprotected sexual encounters, more sexual encounters overall than individuals of different age groups. According to the CDC report, the gonorrhea rate for women is slightly higher than that for men. Like chlamydia, gonorrhea is more prevalent among young women because their cervixes are still developing and are more susceptible to the bacteria. Women also have more surface area for the bacteria to infect, making it easier for the gonorrhea to be contracted. On other high-risk groups are individuals who have multiple sexual partners and having sexual intercourse with someone of a known HIV positive status. Anyone with a known HIV positive status have been proven to have a higher likelihood of having other sexually transmitted diseases. Because you have a positive HIV status, there might be likelihood that you have other positive sexually transmitted diseases like gonorrhea, and thus these individuals have a high chance of transmitting gonorrhea. Prevention strategies are as follows. First of all, education. Individuals who are properly educated on the presence and absence of this sexually transmitted diseases will have a less likelihood chance of transmitting or getting the disease. Abstaining from sexual intercourse. If no sexual intercourse is taken on, may it be orally, vaginally, or anally, then there's a low likelihood of getting the disease. The disease have not been proven to spread through simple contact with a person who is known to have disease. Always using a condom during sexual intercourse, as well as having a sexually monogamous partner. Now, this may be a difficult one, but having a sexually monogamous partner with someone who is not found to have the infection can decrease your chance of getting the HIV and gonorrhea disease. Now, one way of treating and managing someone with gonorrhea is to have treatment with 250 milligrams of intramuscular ceftriaxone as well as 1 gram of oral zithromycin. Thank you so much for your time.